Okay, let's get started. So I'm starting with randomized clinical trials. I call these RCTs, and I think they do a great job of demonstrating a lot of the principles for good study design across many different types of designs. And so I think it's an excellent place to start. And in this segment, I'm going to talk about how we decide to do an RCT and then what their structure is and how they're set up. So studies of association, this is more broadly an epidemiologic principle that includes both randomized clinical trials as well as observational study designs, such as cohort studies and case control studies, which we'll also talk about. And the principle is that there's some sort of exposure or risk factor that we think actually influences an outcome, and that we want to learn the extent to which it affects an outcome or a disease. And this is why we do these types of research studies. So how does this apply to RCTs? Well, I guess we have to think about when we would first do one. And it depends on what your question is. Most important in any study is what specific question you're trying to address. And once you have that nailed down, then what we do is we go to our toolbox. And in our epidemiologic toolbox, we have in part study designs, and then we have tools for other things like measurement and addressing bias and statistical testing and power. But this part of the toolbox, this drawer, if you will, is about study design. And what we want to do, given our particular question, is to achieve the highest level of evidence we can with a given study design based on our question. So I like this evidence pyramid. There are many out there that look different. One of the reasons I like this is the orange is synthesized or filtered information, where the blue is where individual studies lie. And in this course, we're going to live in the blue area. So we're going to talk about these different types of study designs and how we actually create them. And we're going to start with RCTs. And so we want to do an RCT when the level of evidence that already exists suggests that this is the next important step. So what is a clinical trial? A clinical trial is any research study that prospectively assigns humans or groups of humans to one or more intervention to evaluate the effects on health outcomes. So I've underlined keywords here. It's a research study. There is prospective assignment of an intervention, and that intervention is believed to affect a health outcome. Now, you can have a clinical trial that doesn't involve randomization, but randomization is one of the best tools we have for generating the strongest body of knowledge. And so in most cases, we try and conduct randomized clinical trials. So when do we do these studies? Well, it as I mentioned, it depends on where we are in our terms of our state of knowledge. We want to do an RCT when it's the next logical step. It's the next thing we need to know. You do RCTs when you have something that you can intervene on. In some cases, we just want to understand the natural history of a disease. That's not the time that we do RCTs. You want to be able to ethically and feasibly randomize individuals. So it's not ethical to randomize individuals for a certain level of alcohol consumption, if that was your intervention. And it's not feasible to randomize people if what you want to study is genes. And so it's important to consider what your question is and whether it fits into the RCT study design. The other thing to consider is that RCTs are very expensive. They take a lot of resources. And so we only want to do them when it is the critical next step that we need in terms of answering our questions. How are they structured? So this is a nice pictorial of the time frame and how we design RCTs. And I have a graph like this for each of the study designs that we're going to talk about. So we start with a group of eligible participants. We've screened them and decided that they can be in our study. And then we randomize them to one intervention or another. And so this might be, for example, a type of surgical repair for a cleft lip or a cleft palate. And the outcome of interest is which type of surgery will result in the fewest complications. So in this case, your intervention is surgery and your outcome are complications. And what you want to see is, does intervention have fewer complications than intervention B? And so that's basically how you set it up. And you start now and you randomly assign people to one surgical type versus another, and you follow them over time to see if they have complications. There are 4 phases of clinical trials. Sometimes there's a 4A and a 4B, but generally there are 4 phases. And I think what's most relevant on this slide is what you want to learn. So a phase 1 is you're looking at dose safety, whereas like a phase 4 is what happens in widespread use. So the questions that these different phases are addressing are different. And you can see on the right-hand column in terms of N and length that a phase 1 is typically done in a small number of people, where a phase 4 is widespread. And I included a short video on Operation Warp Speed, which is the US's attempt at creating a COVID vaccine, because I think it does a nice job of illustrating how we are trying to make this happen a lot faster than it normally does. So I don't have any, particular ties to the US effort, other than I think, and there are other efforts around the world doing the same thing in terms of trying to create a vaccine in a really rapid pace that are following the very same principles that are illustrated in that video. So check it out. It's only a minute. And that's all I have for this segment.